Welcome to our community. Susie Thomas with you this morning. Very happy to welcome Sherry Smith from the Stark County Health Department. Good morning, Sherry.
Good morning, Susie, and thank you for having me on the show.
Well, I can't imagine your schedule and what the last few months of your life has even been like. Let's go backwards. I can remember in February and March being so concerned for these poor people in China and what they were going through. Not a thought in my mind that this would become a worldwide pandemic. At what point was the health department concerned?
So we were concerned back in about January because we do a lot of surveillance, and that surveillance entails looking at what we call, it's called EpiX, and it's through the Centers for Disease Control and Prevention, and there's only a few people at each health department across the country that have access to this. And it tells us what's going on all around the world. And we also, in working with the CDC and the Ohio Department of Health as a local health department communicable disease unit, we also get reports of travelers through the Division of Migration and Global Quarantine that are coming in from other countries that have current outbreaks or infections going on. So we were starting to get very concerned in January, and we kept saying, oh, this is coming, you know, because it mostly started, especially in our county, with travelers, business travelers coming back and forth from China.
Mm-hmm. Phew. Well, nothing's in a vacuum. Is there anything else we should be concerned about? What else are you seeing that we don't know about yet?
Well, I mean, other than that, I mean, COVID's been taking the most of our time.
Right.
There is a new swine flu going on.
Oh, swell.
That they're saying has a pandemic proportion. But most of our time and energy is trying to contain and mitigate the COVID-19 or the novel coronavirus pandemic. Because, you know, like you said, February or March, you know, most people in the United States, and especially in Ohio and Stark County, because we didn't start to get our cases until I think it was the middle of February or late of February. We really didn't go full-blown until March. You know, it's still a very new and unusual virus for us. Us in healthcare and science, we're still really trying to understand it, and we're learning as we go.
There are so many different coronaviruses. How is this one different?
Well, yes, there are so many different coronaviruses, and how this one is different is it behaves differently. And because it's so new, most of the coronaviruses that we're familiar with is just like the common cold.
Yeah.
And we think that maybe that's the reason why a lot of our youngsters, our youth, maybe do not develop as severe as symptoms or as many complications as those with underlying health conditions or those in the older population do, because they may have some antibodies having being exposed to all the other coronaviruses that are out there. We're still trying to determine that. And so while it is a very new virus and we're really trying to learn, we want to just get across that prevention is the key. So preventing yourself from being exposed to this virus is the key. You know, in the beginning of this pandemic and throughout the past couple months until, you know, Dr. Acton resigned from the Ohio Department of Health and all that, we constantly heard on Governor DeWine's press conferences and all over Ohio, we always heard about flattening the curve.
Right.
And much can be learned from that because there was a decrease in cases, a decrease in spread of infection, and, you know, we were seeing, following all those travel restrictions that we had here in Ohio and the quarantine measures that we were doing and all that other stuff that we were putting in place, we were seeing a decrease in cases. You know, we're just not seeing that anymore.
Ohio was doing great.
Yes.
We really were. And then we had to open up. People can't not work indefinitely. And I know the governor was giving us guidelines to open up smartly. And use our heads, but we've seen these spikes recently, and even in counties nearby and that we are serving. So that's why I wanted to have you on. Where do we go? I mean, does it mean that if we try to live life that we're going to be having these horrible spikes again, or what do we know?
I don't think so.
Good.
The key is like I said, prevention is the key. So to avoid being exposed to the virus, and everybody just needs to understand that this virus is primarily spread from person to person by respiratory droplets. So if you're in close contact with someone within about 6 feet of distance, those respiratory droplets, when the infected person coughs, laughs, sneezes, or talks, can land in the mouth or noses. I know this sounds gross.
It is.
People who are nearby and possibly be inhaled by them. That's the most common way where we're seeing this virus spread. And unfortunately now, what we're seeing is people, I don't know, we've kind of coined the phrase COVID fatigue. People are over it. I mean, we're over it too, even at the health department.
Yeah.
Our healthcare workers, we're all over it. We just want it to go away.
If we could just say, okay, it's done. Let's just go back to normal. Yes.
If it was that easy,
yeah.
Yes, it would be over with. But it's just not, and we just need people to listen and pay attention to the science and the research. We're not trying to pull a fast one on anybody. We're not trying to take political sides or anything like that. If you would just listen to your health department and the research that is really, good research out there, medical and science-based research. If you follow social distancing, stay away from people about 6 feet. Don't go to, community gatherings with more than 10 people. Try to stick with your people. And there's a lot to say about mask wearing. Many of our people think that because we lifted the restrictions that the virus is gone. It is not gone at all. We're seeing a rise in about 24 states across the United States, while other countries are doing very well. And, this rise also includes Stark County. The past couple weeks have seemed, Susie, like it's been February, March, and April all over again for us.
Well, I think, Sherry, because it's an election year, everything becomes political.
Yeah.
And I know I have dear friends who honestly believe that this is some kind of a conspiracy, just seeing how easily you can get people to comply. And if we can just get them to comply with wearing a mask in public, what else can we get them to comply to? And what would you have to say to somebody of that mindset?
Okay. Well, I would first say that mask wearing is one of the most important things that we can do. Americans just aren't used to being told what they should do.
Right.
They're not used to wearing a mask. So everybody's trying to find reasons not to wear them and questioning everything. Masks have become a very important part of this country's current cultural climate. And so it puts people in battles over the balance among safety, personal freedom, economic well-being. But someone who opposes mask wearing downplays the dangers of this new virus. This virus can cause mild illness, and usually in young youth and young adults it does. But we can't be amiss, and we can't forget that it has killed over 130,000 Americans.
Yeah.
So we need to remember that. And if we're not willing to wear masks for whatever reason, masks are an imperfect defense against COVID, but the evidence shows that when combined with social distancing, and I said that 6 feet, and also frequent hand washing for at least 20 seconds, can slow the spread of this virus.
Yeah. As I understand it, the mask wearing is not so much to protect me, it's to keep me from breathing anything I might have on someone else. Because one wicked thing about this virus is it can go undetected and people can be spreading it like Typhoid Mary without having any symptoms or realizing that they're doing it. So the way I understand it is we wear masks just in case we might be dangerous to someone else, and then they're wearing their mask to protect me. Am I getting that right?
You are. So I think of it this way. You are wearing a mask to not be selfish and to be the plate to others, because your mask, protects everybody else. The primary benefit of a mask is to others. So if you're wearing one, and if you would cough, sneeze, or do anything where a respiratory droplet might be, exhaled or go out of your mouth, that mask is a barrier that blocks the flight of the virus droplets, and those droplets never make it out to the other person.
Right.
And if some of them do, they're smaller droplets, and they don't go very far. So again, combining those mask wearers with social distancing of at least 6 feet is the best thing that we can do.
Is there a better kind of mask to wear than other kinds of masks? Is it okay to wear the cute ones?
It is. There really isn't. And I just say, wear whatever mask makes you comfortable. It doesn't even have to be a mask. It can be any sort of face covering that covers your mouth and your nose.
Oh, yeah. When this first started, I was just doing clever scarf folding.
Exactly. And you still can. That's also considering a face covering or a mask. Anything that covers your nose or mouth is totally appropriate. And the other thing that I would say to everybody else is try to comply with your health department. I know that everybody's tired of hearing this, but we really are in this together.
Yeah.
And another way that is very important for us to prevent the spread of this virus is when we get a case of COVID-19 infection, somebody who actually either has symptoms or is what we call asymptomatic, does not have symptoms, and we need to do an interview with them, we ask them to identify any place they've been, any event that they've been to. They do have to tell us about places they've been and events they've been to, and they do have to comply with us and isolate so they're not out exposing everybody else. But we really do ask them and encourage them to tell us about the contacts, anybody that they might have exposed that's been closer to 6 feet, within about 6 feet of them, for longer than 15 minutes of time. So we can give those individuals a heads up and say, hey, you were exposed to somebody with COVID-19. We don't tell them who that person is. We give them education. We ask them if they have a thermometer. If they don't, we provide them with a thermometer. We help them with monitoring of symptoms. And if they do develop symptoms, we help them coordinate testing for themselves.
Mm-hmm. I started thinking it might be a good idea to just keep track of everywhere I go, just in case, because then it would be really easy to be able to say, okay, I was at this place in such and such a time, and then people could find out who else was, shopping in Home Depot in between those hours. But it would have been super easy back in March where we weren't going anywhere. But now that it was sort of like opening up a bit and we're going a few more places and perhaps even eating outdoors in different places, and to be able to just keep a personal diary of where we go and what we do just in case, then it makes it super easy to report if for any reason we need to do that.
Exactly. And I know a lot of people actually do that. I, for one, do that with my cell phone.
Oh, sure.
So my cell phone calendar pretty much says everybody that I talk to and everywhere I've been on any given day.
Yeah, well, it just seems smart. Now, I don't believe everything I've read on social media, but there is some information going out there about how dangerous it is to wear a mask because you're breathing your own carbon dioxide. Can you address that?
Yes, absolutely. Okay, I first want to say that I realize with a lot of people that do not believe in masks and aren't willing to wear them, it hasn't helped because the public health messaging on the mask has changed since the beginning of the pandemic.
Right, several times.
Yes.
Because I think no one knew.
And that inconsistency, and I want to get across the importance of that inconsistency was that in the beginning of the pandemic, the United States, Ohio, us even in Stark County, all of us were in no place to know what worked and what didn't work against this virus at that time because it was so new. And then also, we didn't have enough personal protective equipment to give to our healthcare workers, that were treating these sick people and also for sick people to wear.
Right.
So that's why it's changed so many times, at least on the science and medical end of it. I'm not going to get into the political side of it.
Yep.
But as for oxygen and carbon dioxide in masks, there's no evidence to support the idea that cloth and surgical masks, and by surgical masks, I mean those blue rectangular masks that kind of go over the ears with a loop.
Mm-hmm.
It's mostly what we call them surgical masks or ear loop masks, and that's usually what like nurses and doctors wear in the hospitals and nursing facilities. Either one, the surgical mask or the cloth mask, they just don't fit tightly enough to impede airflow or trap carbon dioxide.
Yeah.
And if you think this through, okay, even with the surgical masks and even the cloth masks, because in some facilities we do have healthcare workers wearing cloth masks as long as they're not treating sick people. So we don't have emergency rooms full of people who wore a mask and became sick because they were wearing a mask.
Right.
Think about it.
Yes.
The mask can be uncomfortable, I get that. And they may make some people feel claustrophobic, but carbon dioxide is not an issue with masks. The true issue with masks is that people just aren't wearing them.
We're speaking with Sherry Smith from the Stark County Health Department. Going to take a short break. We'll be back after these words. You're listening to Our Community. Welcome back to Our Community. Susie Thomas visiting with Sherry Smith from the Stark County Health Department. Okay, there are two trigger words. One of them is masks, and the other one is testing. So let's talk about testing. First of all, who should get tested?
So somebody that should get tested is somebody that has symptoms of COVID-19 and who has been evaluated by a healthcare provider, whether that be their primary care provider or they've called into their local health department and spoke with somebody in their communicable disease unit. So we can evaluate what symptoms they're having and then coordinate testing for them either through the health department or their primary care provider.
And symptoms seem like symptoms that we have for a number of different things. Can you kind of go through the kinds of symptoms that might be a flag to make us think, perhaps I should get tested?
Yes. So there are tons of symptoms. And like you said, the two biggest symptoms are cough and shortness of breath. Okay, but there are a number of symptoms that go along with that. And so what we do is look at have they had any travel, have they been practicing social distancing, have they been wearing a mask, and then couple that with all the symptoms that they have or are displaying, and then sort of do a physical evaluation of those symptoms. Because the other symptoms are like fever, chills, nausea, vomiting, diarrhea, stomach pain, runny nose, congestion. It's almost every symptom that you can imagine for any other illness.
Sure.
So that's why it's very important that if you are sick and you're experiencing any of those symptoms, that you either stay home or if you experience them when you're already out and about or at work or something, you notify a supervisor and you go home. Mm-hmm. It's very important that if you are sick, in order to help prevent the spread of COVID, that you stay home.
That's a culture change because in our culture, it's sort of a red badge of courage to go to work sick, to soldier on, to just take some meds and go in anyway. We really need to get out of that mindset, don't we?
Yes, we do. Yes, absolutely.
Sherry, what's involved in a test? How is it painful? Is it what happens during one of the to be tested for COVID?
Okay. First, it depends where you get the test at. Different facilities do different types of tests.
Is there a better test, one better test than another test?
That's debatable. I would say that all the tests that are out there and that are currently being done are all licensed and approved by the FDA, and also they go through the same laboratory processes. So I guess I would say no. The most common way that individuals are tested is called a nasopharyngeal swab. And it's like a cotton-tipped applicator that goes up through your nasal passages up into your pharynx. And that type of test should hurt if done properly. It does hurt a little bit, can make your eyes water a little bit. Another common test that's done, it's of the anterior nares, so it's right inside the nose, and it's basically a swab of both insides of your nose. And that one, doesn't really hurt. It just feels a little uncomfortable.
Feels funny.
Yes. But we do not condone any sort of mass testing, at least not at the health department level. We only suggest that after you've been evaluated by either your primary care physician or somebody in communicable disease at the local health department level, and that's over the phone, because we don't want anybody to show up at their doctor's office or the health department sick.
Mm-hmm.
We want you all to call ahead, and then we will evaluate you over the phone based on, your social behaviors, your physical symptoms that you are experiencing, and just how you feel. And then we will decide whether or not it is a good time for you to be tested. We want everybody to be tested who meet those criteria, and only if they have symptoms, because you could be tested and not have symptoms and come back as a false negative, because with this virus, you can have no symptoms and still be contagious.
How concerned should we be with a false negative or even a false positive diagnosis?
I would say not that concerned, because if you are practicing those healthy behaviors of trying to social distance yourself, trying to cover your face, your nose, your mouth with a face mask when you're out in public, I would say not that concerned. The testing has come a long way. I will say that, more efficient testing has played some role in the climbing case counts.
Sure.
But it has not played that big of a role, okay? Because the number of tests that we've administered now is nearly double from what we did in April and May. But the positive test rate tells us that the testing can't explain away the rise. If you think about it, if a lot of tests are being conducted and the spread of the coronavirus has been reduced, then the positive case rate would also fall, but it's not. It's climbing. And our biggest concern right now, and the number of cases that we're seeing the increase in, is between the ages of 18 and 49.
Oh, dear.
Yes.
And we thought those younger people were almost immune to it, or in some ways less susceptible to it. How does more and more testing help us fight this?
I would say that more and more testing helps us fight this, because if those people that are truly symptomatic and need to get tested, the testing has come a long way. It's fairly accurate, and as long as they don't get tested too early, too soon, it should be an accurate indicator of infection.
All right, let's just say you're around somebody and they're not wearing a mask and they're sneezing and you're around them for more than 15 minutes and you don't really have any symptoms. How long do you wait before you say, I just want to know?
Well, if you're around somebody without a mask, within that 6 feet of distance, I would suggest trying to find out whether or not that person might have been sick. Mm-hmm. If it's somebody that that you spend time with, if you know that they have become a confirmed case, call your local health department and say you were around that person. You then become a contact. And then you'll work with your local health department as a contact, and those things are basically spelled out for you and determined on whether you should get a test or whether you should just stay quarantined in your home. The virus, once you're exposed to somebody with the infection, you can actually develop symptoms up to 14 days later.
Wow. It's a real bug, isn't it? Just waits like it's lying and waiting. For 14 days is a long time to know. And again, we're Americans. We really like things right now.
Yes, yes. And within that 14-day time frame, I will say there are, healthcare workers, there are critical infrastructure workers, and I think of like first responders, those that work in jails, those that work in like meat manufacturing facilities, and other things that make up the infrastructure, the essential workers that were still working during the shutdown, if you will. Those individuals, as long as they're wearing masks, and they would have to wear it all the time if they were identified as a contact. They can't even take it off when they're in their own closed space within a facility during those 14 days.
Wow.
But they can still work as long as they're doing the temperature checks and the symptom monitoring and all that stuff. And once they develop symptoms, they're out of the facility and they're home and isolated. Then they're back on the phone with the local health department where they live, and we are coordinating testing for them and helping them out with more education about the virus, about their symptoms, and about stopping the spread.
What do you recommend for the rest of the family members in the home with that one who's been diagnosed?
So we usually recommend if somebody's been diagnosed with as a case who actually has a positive test for COVID-19, everybody in that house is also on quarantine.
Yeah. If there's a positive to this, it seems that as the number of cases goes up, then the percentage of fatalities seems to be lower. Am I reading that right?
Well, you are, but let's keep in mind that the current age group that we see a rise in is 18 to 49. And this virus mostly affects those over age of 50 and those with underlying health conditions. It's important to remember that at the beginning of this pandemic, when we just started seeing outbreaks in all of our long-term care facilities, and it's because that was before our long-term care facilities, our skilled nursing facilities, and our hospitals were closed down.
Right.
So they were having visitors, they were having people come in through the ER with symptoms, and they were infecting our older population who are more susceptible to this virus. Well, now we've closed down those long-term care facilities. We still haven't opened up our skilled nursing facilities. We've only opened up our assisted living facilities to outdoor visitation and allowing them to go home, for some respite short term. But I will say that since we've seen this rise in cases between the ages of 18 to 49 mostly, we are now starting again to see infected cases at the assisted livings.
Oh, dear.
They have access to those. So I really fear, and I'm sure that all the other healthcare community out there really fears, that as these cases increase in the younger population and they have mild symptoms or maybe no symptoms, but as they spread this to their loved ones, their parents that have underlying health conditions, let's say their dad who has diabetes, their mom who has asthma, or their grandparents, we're going to be back in the same boat, if not worse, than what we were back in February and March.
Well, that is not the note I wanted to end on, and I only have about 1 million more questions I would love to ask you, but we are out of time. Sherry, what's the website that we can go to keep up on all of the most recent information? And we certainly will wear our masks and wash our hands and keep 6 feet apart from each other, and above all, pray, pray, pray. But what's a good website where we can keep up on all the latest?
You can go to any of your local health department websites. Like the Stark County Health Department one is www.starkhealth.org. I would also recommend going to any of the local health department Facebook pages. We do an epidemiological report twice a week on Tuesdays and Fridays so that you can get a true picture of what's going on in your community. And then also the Ohio Department of Health and the Governor's Office has a website. I believe it's coronavirus.ohio.gov, but I could have that mixed up a little bit. But if you just Google coronavirus Ohio website, it will pop up.
Awesome words. Thank you so much, Sherry Smith, for all you do in our community.
Thank you. Stay safe. and healthy.
You too.
Here. Okay. Bye-bye.